right. So I'm going to talk about the 4 neuromodulation devices that are on the market: Cephaly, STMS Mini, GammaCore, and Neurivia. I'm going to talk about their FDA indications, how they work, or how we think they work, how to use them. I'm going to demo these devices. We're going to talk about some side effects, some contraindication, the cost, and how you as the patient can obtain these devices. All right, so what is neuromodulation? Neuromodulation is using electrical currents or magnets to modulate or change brain activity. So we're going to start with Cephaly, and just pay attention to this picture here, because this is going to is indicative of the mechanism of action of this. All right, so this is FDA approved for the acute and preventive treatment of migraine in people 18 and older. There's 3 models available: prevent, acute, and dual. All right, now how does this device work? Okay, it's transcutaneous, so it's through the skin, external trigeminal nerve stimulation. Specifically, it's over the supratrochlear, supraorbital branch of the trigeminal nerve. And the thought is that when you're in the acute setting, that it causes a sedative effect to the nervous system. And then in the preventive setting, it's thought to restore normal metabolism in the frontotemporal cortex. And this, in turn, is thought to reduce the frequency of migraine attacks. That being said, in the clinical trials, it was a gradual improvement, and it took about 2 to 3 months to see that. All right, so how do we use this device? All right, so they want you to clean and degrease the forehead. They want you to place the electrode. You want to take it off. Now, I have live demos here. None of these are going to be live. So you put the electrode across the forehead like this. Here's your Cephaly device. It sticks like that on there. The first one that came out actually was like a crown, like Wonder Woman. So it was nice that they came out with this little device. Now, like I mentioned earlier, there is a device that does both prevent and acute, or you can buy just the acute, or you can buy just the prevent. If you have the dual, the acute setting, you press it once and then it will last for 60 minutes. The prevent session, you press it twice and it'll last for 20 minutes. It's recommended to do the prevent session in the evening because it can cause a sedative, relaxing feeling. So they recommend that that's done at bedtime or in the evening. Both of the settings the intensity will slowly rise over 14 minutes. I'm told that it does take a while to get used to the build of intensity. So what you might tolerate the first couple times may be different than what you tolerate going forward. If the intensity if it's too intense, you just press the button once to stabilize it. Or if you become a pro at it and you know where you need to go up on the intensity, you can keep pushing the buttons until it goes up. Sorry, wrong way. Side effects that have been seen is the intolerance that I mentioned earlier, that feeling of fatigue that I mentioned earlier, headache was reported, and then irritation of the skin and forehead due to the electrode. And they do have a different type of electrode if people are sensitive to the initial one. Can we have some people put on their mute button? We're getting some interference here if people don't have their mute button on. Thank you. Wonderful. It sounds a little better. Great. Okay. So who do they recommend not use this? Okay. People who have implanted metallic or electronic devices, suffering of pain of unknown origin, and then any sort of cardiac or implanted pacemaker or defibrillator. So how do you obtain this device. This is the one device that patients come to me, ask me for a prescription, I hand it over, and then the rest is in their hands. They contact the company directly and do the purchasing through the company. Unfortunately, it's not covered by insurance, but it is covered by the VA medical system. Some patients will use their health savings account. Cephaly was very upfront on their website about their cost. It was clearly spelled out. The dual device is about $500, and the Prevent and the Acute are about $350. So it seems like somewhat of a deal if you know you're going to use both, just to go to the duo. Electrodes are a set of 3 is $25. And it looks like those blue gel ones, which people can buy if they're sensitive, are a little more expensive. So on the Cephaly website, it says for the regular electrodes, you get about 20 uses per the regular and about 12 uses for the blue gel electrodes. So that's the Cephaly. I'm going to move on to the gammaCore. Okay, so this is a non-invasive vagus nerve stimulator, FDA approved for both preventive and acute treatment of migraine. It also has an indication for cluster headache as well, but my focus today is going to be on the treatment of migraine. So how does this device work? It activates the vagus nerve. The vagus nerve plays an important role in regulating your body's inflammatory response, your body's regulation of pain, and it's thought to help block pain signals that cause migraine. All right, so how do we use this device? So first, you want to find the spot on your neck. You want to run your fingers down your neck, and you're going to find your pulse. The vagus nerve runs by the pulse. A lot of people look in the mirror when they first start doing this, so they know they're in the right area. The device looks like this. You take the cap off. You're going to apply the gel that the company gives you, a dime size each, okay? And then you're going to place it on your neck. Again, you want to look in the mirror. You turn it on, and then you want to increase the intensity. You'll know you're in the right spot if you start having a muscle contraction over here and your lip starts pulling down, as illustrated in number 3. Usually that happens with the intensity, between the intensity level 15 and 25. The maximum level is 40, and some people do need more than the 15 to 25 to get the desired pain response. The next slide here, I have what the recommendation is for both preventive and acute therapy. So the top slide's a little blurry, but basically it says for preventive, you're going to treat morning, mid, noon, and evening. You're going to do 2 2-minute stimulations, both of those times. And then for the acute treatment, at the onset of the pain, you're going to go do 2 2-minute stimulations, wait 20 minutes. If you still have pain, do that again. Wait 2 hours. If you still have pain, do that again. So side effects, some of the common ones were discomfort and redness at the application site. Some people reported some dizziness, and some people reported some tingling, but not as a major discomfort, just that it was a sensation that they felt. So contraindications. So the top of the slide are types of patients that were not studied. So they're not recommending it be used because we don't have data to support it. So coronary artery disease, anyone with surgery of their vagus nerve area, pediatric patients, pregnant women, and anyone with blood pressure or heart rate issues. And then similar to the Cephaly, they don't want it used with people with implantable devices, pacemakers. They included on here hearing aids. And they also discuss metallic in like the head and neck area. This one was the only one I saw that didn't recommend the use of this device with any other portable device. So don't use this while you're using a 10 unit, and don't use this while you're using your cell phone, was also listed there. So interesting. Okay, how do you get this device? You're going to talk to your provider. The provider is the one that initiates the prescription, fills out the form, and sends it to the company's specialty pharmacy. And then you hear directly from the specialty pharmacy at that point. So what is the cost of this one? I actually could not find price on the company website, so I emailed the company, and this is the email that they sent back to me. So 31 consecutive days is $600, and then they talk about refills. It wasn't clear to me if refill was $600 as well. So I have another email I sent to them, and I'm just waiting to hear back. And then there was another paragraph about potential, they would submit it to your insurance company to see if there would be any payment. To my knowledge, I'm not aware of many insurance companies that cover this device. Okay, now I'm gonna move on to the STMS Mini, okay. So this is FDA approved for the acute and preventive treatment of migraines in both adolescents and adults. So out of all the 4 devices, this is the only one that's approved for under 18 years of age. The rest are adult only. Okay, so what is this? Okay, this is, it's basically a big magnet, and you'll see it in just a minute, and it's pretty heavy. It's about 3 to 4 pounds, actually more like 4 to 5 pounds. And it gives a single pulse, it gives a single pulse weak electrical currents through the skull, and it excites and depolarizes the neurons in the brain. So here I go with here's the device here, here's the power, and here's where you do your pulses. Right here is where you're supposed to cradle, it's supposed to cradle the back of your head. So you're gonna put it behind your head like this. You wanna have the buttons at the bottom so you can use your thumb and push here. For the preventive mode, it's 4 pulses twice a day. And then for the acute, you can do up to 17 pulses a day. And what are the side effects of this? Momentary lightheadedness and ringing in the ears, which resolves once this treatment is over. And similar to the other devices, they're not recommending to be used with other implantable devices, pacemaker, vagus nerve stimulator, any other neurostimulators, defibrillator. And then they also list other examples of implanted medical devices. It's more focused head and neck area. It also mentions facial tattoos with metallic ink, something to think about. And then this one goes into also bullets, pellets, things that I didn't see mentioned in the other ones. So how do you obtain this device? You want to talk to your physician, nurse practitioner. Then it would be the office, your provider team that would fill out the paperwork, send it to the company, and then you'll hear directly from the specialty pharmacy. So what is the cost of this? This was also I didn't clearly find it on the website. I had to email to get pricing. You know, this is the email that they sent back to me. You do not purchase this device. It's a rented device. Clearly saying it's not covered by any insurance. It's all out of pocket. They have a new patient special where it's $250 for the first 90 days. And then after that, it looks like it's about $250 a month. And then lastly, we have the Neurivio. And this is the newest one to be FDA approved. And I think it hasn't even been on the market for a year yet. This one is FDA approved for the acute treatment of migraine in adults. Notice this is the only one that's not FDA approved for preventive treatment. So this is acute treatment only. So how does this one work? This is a busy slide. And the picture here kind of might help you visualize it a little better. So the device is going to activate sensory fibers that are located in your upper arm. That's going to send a signal up to your brain stem. And then that information is going to activate descending. So now it's going down pain inhibitory pathways, which are thought to help with migraine. So how does this one work? So this one is very 2020 intuitive. It is you use an app on your cell phone, and you have your device here. Okay, you're going to wear it on your arm. The earlier in the migraine, the better. What they saw in the clinical study. So you want to treat it as early as possible. So on the front here, there is a on switch, and then also this is how it communicates with your app down here. And then on the back the device itself is an electrode. Okay. And you put this on your arm, interact with your cell phone, and you want to leave it on for 45 minutes. Less than 45 minutes was not clinically significant in the clinical trials. So 45 minutes is what's recommended to get the best results out of it. It also comes with an armband, so somebody can put it on and kind of move around, have a little more freedom. This is what was listed as the side effects. So all the ones in green are what was listed. So mostly things, less than 1% of the people reported it: spasm, arm pain, itching. So the most common that was reported was a warm sensation in the arm. So who shouldn't use this device? People with any sort of heart condition, any sort of implantable medical devices. And then also, because you are sticking something on your arm, it's important to make sure you have healthy skin there, no implants, and not near the proximity of any cancerous lesions. So how much does this one cost? This one is $99 a month plus shipping, and you get 12 uses out of one of these, and after that it gets discarded and you won't be able to use it anymore. So it's not really, so if somebody has episodic migraine, this could last. I have one patient this lasted 3 months because she supplements it with her triptans. So it's not necessarily a monthly, its device is 12 treatments. So how do you get this device? Again, you want to talk to your neurology provider. They're going to fill out the form. They're going to send it to the specialty pharmacy, and then you'll hear directly from that specialty pharmacy. Interesting, and we're seeing this with some other migraine meds. The company actually offers a telemedicine visit with a specialist. So if you want to bypass your neurologist, or if you don't have a neurologist, you could pay $45 to speak with, to have a telemedicine visit, and that's a consultation fee. And that is another way that if you qualify and meet the criteria, that's another way that you can get this device. So I spoke much faster than I thought I would. So what are the pros of these devices? So they're non-invasive, portable. They're portable, and this is interesting. This one has a picture next to a pocketbook, but this is, this is about 5 pounds. This would be a little heavy for me to be, but the other ones are smaller. They're drug-free options. That means no drug-drug interaction, no drug side effects. It's a great alternative for people who are resistant or intolerant to the medications that we have. Another thing is it could be added to your regimen that you already have. So you don't have to take away what you have, and you can add this on without it being another medicine. The side effects are minor and most are reversible. Once the device is off, they go away. And fairly limited contraindications for use of these devices. And the biggest con is money. Most are not covered by insurance, and it's cost prohibitive for most people to afford these. And as Deborah was earlier saying, people who have migraine and who have disability because of migraine and job loss, not having access to this it's a shame that we only people who work and have the funds will have access to these devices. When I was doing research for this, Dr. Tepper did a talk on this, and he was really pushing for both patient and physician being advocates. And this is basically going to the insurance companies and saying, why aren't you covering these? At this point, these are cheaper than the CGRPs that we have, and they're just not interested in covering these devices. And they could be a cost-effective and less side effect option to add to regimens, and we're really not able to get a lot of patients on this. Another thing I forgot to mention, pregnancy. The STMS is actually FDA. It's not because that's ours. It's approved for pregnancy in the UK. They did some testing on that. The rest of them weren't even tested in pregnancy, but the STMS is approved for pregnancy in the UK. So, and I'm open up to any questions that anybody has, or if anybody wants to see the device again and want any of the devices. If I went through it too quickly.
Thanks, Alicia. I have the questions here in the chat. I'm going to read them off to you. I think that would be the easiest. So the first question is, it covered by insurance? I think someone was referring to the Nerivio. I think the answer to that is no.
No. Yeah. I mean, no. Like the VA is Cephaly, and then maybe another one, but other than that, it's very, very limited coverage, unfortunately.
Okay. The next question is for cancer patients with migraine or others who have a chest port, are any of these devices okay?
I don't recall seeing port, but that would probably be something we would want to check with the company to get their input when it's something that there could be some metallic in there. So I don't know that answer, but if it were my patient that came to me and asked that, I would go to the company and I would talk to them directly and get their input, and then bring it back to the patient and have a discussion and say, do we have enough information here to think that we could do this safely, and then make a decision from there.
Okay, which is the next question is, does someone know which device is best for them, or is it trial and error?
It would likely be trial and error. I know some of these that we have here are live devices. They might not all be. So I've had a few patients where, I don't want to use the word lucky, but they've been in my office with an acute attack, and I've said, hey, let's try the gammaCore, the VNS. So I've had the opportunity to have some of my patients try it during an acute attack, and I'm sure Jefferson has as well. Some of the companies here and there have free trials, like Nerivio, when it first came out, they piloted some programs and some patients got free trials. Cephaly used to have a 60-day free trial, but that being said, sometimes it takes 3 months to become fully effective, or so some of them might have like money back guarantee if you send it within a certain amount of time, but otherwise it's hard to say what. Now, acute, 3 of them are acute and preventive, and 1 is only acute. So that would sort of maybe tease out a little bit the needs of the patient. How frequent are the migraines might tease out a little bit because of cost. Somebody has a lot of migraine, you're going to use up the Nerivio 12 very quickly, where someone who doesn't, that might last and stretch over months. So.
Okay, great. The next question is, do these devices adhere to the skin other than the STMS Mini? I don't think that, maybe you want to re-ask that question, because the only one that adheres to the skin is the Nerivio. So
2, the electrode of the cephalate.
Right, the
yeah,
cephalate.
The electrode of the
Right.
the cephalate adheres, and the Nerivio, this adheres to the skin. So there is a risk of irritation, or the gamma core is they're like metal, and you put like an ultrasound gel on them. Okay, so you have most people are not allergic to that type of medium, and then this one is just, your head just sits in this like head rest right here. So.
Okay. The next question is the STMS the same type of treatment used for depression? Do any of these have lasting impact, or are they all short-term only?
So it's my understanding that this is a much lower dose than depression. But I believe that the depression, using it for depression, they sort of, in science, they build off of knowledge they already have, and then they bring, so this is brought to a much lower level than depression.
Okay, so we have time for one more question. I'm going to combine these 2 questions. Is there a maximum age limit for these types of devices that stimulate the brain, as well as is there a minimum age limit? I'm sorry we can't get to the other questions.
I did not see any maximum age limit. They all said either adult or 18 or older, except for the STMS, which is, I believe it was 12 and older. So it used the word adolescent. 12 and older, yes. And that's the STMS. That's the only one that's approved for under 18.
Okay.
So.
All right. And finally, there is a Nerivio rebate. You can go to their website to learn more. That's all we have time for. We are going to actually go into breakout rooms in just a moment. So I want to take this moment to thank you, Alicia, for coming
Thank you for having me
with us today, because it was very useful and helpful, and I think a lot of good questions. So,
great.
Okay, so with that,